All right, thanks to our patient and everybody. Just kidding. These are your exits. Tip forward just a little bit. All right, so patient position, as you know, is kind of the crucial thing. Trying to get the higher windows. So here's my higher window. As she breathes out, I'm going to get it there. So I'm holding my transducer in position right now as she breathes. Notice when she breathes in, go ahead and breathe in, it disappears, and then she breathes out. And so I don't try to chase it when it's breathing out. Okay, but I want that nice high window if I can. If I come to the lower window, I can get really good walls, but then I don't see the aorta in a good axis. And trying to get that all lined up that way is going to be more difficult. So I'm going to come to the state of the higher window if I can. So initially we want to see behind the heart decently, so you take a clip of that kind of from the overall perspective, and then we'll start to get in a little closer. So go ahead and take a breath in, push it out, hold it up for just a moment. Okay, I'm going to even higher window here right now. Breathe away. So notice as she's breathing, I'm now going and freezing and scrolling back. So I'm not scanning right now, I'm just kind of holding the transducer roughly in the position I'm at. Go through the measurements. So let's start with aortic root since we're right there. Nice high window. See the aortic valve. We're looking for a central closure of the aortic cusps. The zona coapta it's called. Let's see. I have to think here for a second. Where's my aortic root? So aortic diameter, so remember leading edge to leading edge, we're doing that because it's consistent with M mode. Okay, I take that picture at this moment here, and then I take a separate picture. So notice that we're taking this right at this point here, just before the valve opens. So I'm timing it exactly the same as I'm timing my aortic valve in M mode. So as it's closed, right at the end of the closure there, just before it opens, is where I measure that aortic root. So I'm measuring that at the same timing here on 2D. So that's important to have the correct timing. Take the measurements off, and then I'm just going to scroll forward and back. I'm looking now for the left atria, so see valves closed. I'm scrolling back and forth, so this is backward. Now forward, just as it opens, I go back till it closes. Not the sharpest image, so I may try to get this again, but I'm going to take it anyway while I have it. So I'm going to take my left atria, diameter, leading edge to leading edge again, just like M mode, perpendicular to the direction of the chamber. Okay, and I can go do the 2D measurements and everything. Let's just do that. So I'm going to drop down a bit. Good, take a breath in, push it out. So nice open chambers. Ideally, I don't want a lot of papillary muscles in there. Freeze up. So I'm scrolling back and forth all the time here. So I'm scrolling, I'm looking at the muscle. So again, two ways you can do this. You can either look at the EKG, where the little red mark is on the EKG, or again, like I do, is I scroll back and forth looking for the widest dimension of the muscle. So remember, we're trying to define the wall. So ignore all this garbage in front of that, which is papillary muscles and cords. We're going to go through, select the walls now, so we'll start with the septum and diastole. You want to be fairly just past the mitral valve tips. I don't want to be too far back here because that's about mid to apical area. There's kind of a bright line on here. Remember that the right ventricle has trabeculations on that side, so just be careful not to have trabeculations included in the measurement. Each system is going to be a little bit different in how you have the calculation package. So this one, I set it, I lock it, then I have to set again to get that position locked. But basically where I ended there is where my next one wants to start. So the first one was the IVS. This is now the LVID in diastole, and then the posterior wall. So remember, caliper comes right to the beginning of the bright line. Don't go on to or past the bright line, because then you're too far. And then scroll forward, full squeeze. when I'm looking at the full squeeze, I'm watching the muscle. I'm watching in particular, the septal wall is easy to see. It's the posterior wall that's hard to see. So I'm watching my posterior wall thicken, and I kind of go back and forth. I again look at the muscle itself squeezing and the chamber being the smallest it can be. Or you can use the EKG, which happens to be right at the end of the T wave in this case. I'm leaving out a little bit of the trabeculation on the right side of that heart there on the septum. Okay, my chamber, so again, as I was watching the wall, this is the beginning of that wall here. All this stuff is cord and papillary muscle. Again, perpendicular across the direction of the chamber just past the mitral valve tips. Taking pictures of that. Okay, so I've taken my aorta, I've taken my walls. Okay, now we're pretty much ready for M mode. So I like to get things lined up before I start, so I take my cursor. If you have a cursor available, you should use the cursor before you actually go into the mode. So we're going to kind of line up. Go ahead and just take a small breath in, push it out. So now I'm kind of having her push out, get ready. Make sure I'm seeing good sharp walls on both of these. That will tell me I'm in the center of that structure. Look for those valve leaflet tips. Okay. And then I should get a nice box. Okay. Again, I can save time by going through and doing this, but what am I looking at? I'm looking for a fairly central closure of this valve here. The box is the opening of the valve leaflets apart from each other. Again, what's this valve leaflet there? Or right coronary cusp and then non-coronary cusp at the back. Okay. So in this case, I'm going to use the package that's set up for that, the LAAO. So I choose that, and then I'm going to go from this. So this wants the aorta first. Again, leading edge to leading edge just before it opens. Set that. The next one it's asking for is the left atria. Okay, then it's going to ask for the cusp separation. So the cusp separation. So see how they're all kind of together. Normally I do aortic root, the cusp separation and that, but because this package is set up that way, that's just how I do it. So that's those. Next level is the mitral valve leaflets. So I can go out of the image if I want, or I can just learn to use the image that I have up in the top there, the reference image. So mitral valve tips, I need to see not only the anterior mitral valve leaflet moving, coming close to the septum, that all has to be nice and clear. But I also want to make sure that I get that posterior leaflet in as well. So I should see kind of an opposite movement from the anterior mitral valve leaflet. Okay. So once we get our E wave, which is the first wave, and it happens to be the biggest wave, but it won't always be the biggest. You can also line it up to the EKG, so right after the T wave is where my EKG should be. In this system, it's got it under the user defined. So we measure, I usually go from the peak of this right to the beginning of that septum right there. So we're at 0.8 centimeters or 8 millimeters roughly, which is normal. Okay, again, stay at that nice high window if I can, because see how nice and clear the walls are up here, nice and perpendicular to the chambers. Again, I don't need to see all of this image super well, I just need to see this area really good. So again, place the cursor out, make sure your chamber size is as open as it can be. I'm getting a good interface on that posterior wall. If I went back here, for example, I'm not going to get as clear of an M mode, so let's just go live there. So see how the septal wall is not that clear, the posterior wall is not as clear. Okay, as she breathes out, I'm going to get where it's nice and perpendicular. Good interface. I move my transducer around a little bit, and then I get very clear walls. Just get a little bit past the mitral valve leaflet. Wait for the breathing. Okay. Now this little spike here, I'm getting just, that's some of the cord that's actually moving. I do want to try to get that out if I can, get a little bit further down than that. Go ahead and hold it right there. Don't breathe for just a moment. Okay. But you get the idea. You can see nice clear definition of the septal wall and the posterior wall. behind the posterior wall there's a little bit of dark space back there. That's okay. That's just kind of the normal pericardial fluid that's in that area. And you're allowed to have so much of that. So same thing in M mode, we're just going to measure this quickly. So again, widest portion. So I just jump to the widest portion. I don't necessarily look at the EKG. But this line is going to go right across my EKG and kind of line up with there. So right before it contracts is right here. Again, get to know your measurement package so that you know where it's going. I'm looking at this consistency of that gray. That's my wall. If I start getting brighter in the back, I'm no longer in the wall. I like to take the systole and diastole measurements separately just because when I start measuring this it can get a little bit hairy. In this case it comes up a little bit, so it's right there. Okay, so that is those views. And what's next?
Zoom.
Yes. So I zoom my box just appropriately so that I can get, remember, the mitral valve I want to see the aortic valve, and the full atria. So if I'm not seeing at least that much definition, we're either zoomed in too much or we're not quite in view. See nice central closure of that valve. You would take a clip of this. Okay, I would freeze it, scroll back. I scroll backward, I have the valve open. It closes, and then I scroll forward again just a little bit until it just opens. Can you see where the annulus are? There. That's where my LVOT measurement needs to be. So at the annulus, inner to inner, here to there. We should be roughly 2 centimeters. Okay, you don't want to be down here because then we're into a greater diameter. It's significantly different, but you're actually on the anterior mitral valve leaflet at that point. So same view, color Doppler. Okay, make your box, when we're zoomed in like this, you can make your box the size of the zoom because we're already optimized as much as we can. So see how now I'm not just taking the color as I see it, I'm sweeping through the valve. So my beam is going from basically the pulmonary side, sweeping through slowly beat by beat until I get through to the tricuspid there, and then I go back. I'm looking for jets. Okay, I'm not taking it just to get a color image, I want to see where the leaks are. If I don't see a leak, I'm just going to take a representative image. Okay, go out of zoom, out of color. 2D button gets you out of that quick. So that's those views. So we've done everything we need there. So now we're going to tip out to the tricuspid valve. And our patient is a little bit breathing dependent, and that's okay. So in this case, I'm sliding down. Again, get the better window. I want to see the atria. I want to see that valve nicely open. 2D optimization, I can tilt it, and I can narrow my sector size. See out here, I can see the valve, but it's kind of dark. So I'm pushing my window a little bit as she breathes out until I can see those valve leaflets nice and crisp. Okay? Take a clip of that and stick your color on. I like to have a longer color box. Some labs will like you to have a very short one. Okay, see how I'm sweeping through the valve? So I'm sweeping all the way through the valve. There's a little bit of regurg right there. As I swept out even further, I could actually see even more. So I'm moving my window as I go, and I'm trying to see the best regurgitation I can. Once I get that, hold that in spot. I'm going to move my cursor so that we're nice angle to it. Now see that it's moving as she breathes. That's okay. We're going to try to capture this as we go. We want to be in the center of that. Continuous wave. Remember, baseline up, scale right away. If you get a decent beat, take it. We can always come back and get another one. Tricuspid valve, we want the V max. So here's my jet here. I can come down, so we're looking about just about 20 millimeters of mercury pressure. Still within normal limits. Now that I've seen this, every time I see the tricuspid valve now, I want to see that again as good or better than I just saw it. Okay? So we're constantly trying to improve on it. So that's tricuspid valve. Okay, sweep the other way. So again, come back to your base image here, and then we're going to tip up towards the pulmonary. And again, I'm moving my window around, seeing if I can pop that window a little bit better. Go and take a breath in for me. Push it out as far as you can. Okay. I'm not really satisfied until I can see those valve leaflets decently. I'm twisting it a little bit too so that I can get that chamber nicely open. Okay, so I'm going to go with this for right now. So go ahead and take a breath in, push it out as far as you can. Keep pushing. Push, hold it right there, don't breathe. Okay, as she gets set, I'm going to take the clip of what I have, stick some color on. There's my little candle flame, nice column of blue. So I'm documenting the candle flame if I can. Breathe. Okay, cursor, I place it out. Just on that side of the valve leaflets, I'm going to do a pulsed wave. Adjust my scale. Change the low velocity reject, which is the wall filter. Nice pulmonary flow there, so if I want to measure that. So if I do pulsed wave, do you remember what we measure? Pulmonary acceleration time. So that's from the beginning of the wave to the peak of the wave. Okay, then I'm just going to jump into continuous wave. Again, I have to scale so that my waveform optimizes for that strip. Again, I'm taking my low velocity reject and the wall filters down. Decreasing my overall gain. I don't want it to be too bright. Measure. Harmonics, we're going for V max in this case, so just the max velocity. Choose a good waveform. Don't go into the super hazy stuff, just get me what's real. Alright, so that's pulmonary. So that's all of our peristernal long axis stuff. I'm going to open my width back up. I've turned 90 degrees now. And again, I'm going for that base. So what do we want in the base?
The 3 leaflets.
3 leaflets, absolutely. So focus on the 3 leaflets for sure. And then I need to have right atria here needs to have the right ventricular inflow and outflow going around, and then the pulmonary artery open there, and then your left atria is behind it there. So go ahead and take a breath in. Push it out far as you can. Okay, so just try to focus on the 3 leaflets. And again, I'm moving my window around, just trying to see if I can get a little better. Little twists and stuff if I need to. So again, the overall view to start with. Then we'll focus on things. So go ahead and breathe. Zoom in, so just right over the aortic valve. Now I really want to see those 3 leaflets well. Take a clip of that. Color over it. Again, color box should include the entire aorta, looking for any kind of leaks and stuff outside of there, or any shunts. Go out of zoom. Okay, then immediately I go from there over to the, so I've done 2D clip of the aortic valve. Now I'm kind of going over the tricuspid valve. And again, I'm sweeping through the whole valve. What did I see the last time I looked at the tricuspid valve? We saw some regurg, so we want to see that again as well or better. So generally I want the aorta to be in view here, but again I'm going to kind of move my window so that I'm optimizing the tricuspid valve. Okay, you need to have enough to show that you're in that window. Sector size down a little bit, remember better detail. I'm moving my window. And again, sweep through the valve. So there's the bottom of it. That's where that regurg was. So the regurg is kind of at the posterior margin of that. And I want to show a decent representation of what that looks like. And in particular at the leaflet tips. Okay, I'm going to work with the breathing a little bit. Scale. Okay, I'm trying to look for the fullest envelope I can get out of this. Valve, Vmax again. So I'm following this down. It kind of comes down a little bit lower than this, so we're going to be right about there. Again, I'm measuring what's real. I don't like to go out and stuff that I don't really see. What did we get last time on millimeters of mercury? So, yeah, that was something else. So we were right around 20 millimeters of mercury pressure, right? So this, right now, we're actually slightly higher than what we were before. So we're getting the same, if not a little bit better. Okay. Not going to waste a lot of time on that, so we're going to see the tricuspid valve again. Note here as we're scanning, there's also a false tendon that goes across the chamber right here. You can see that bright thin line. Okay. Again, that's just a structural thing. That's a normal variant. That's fine. Okay, go ahead and take a breath in for me. So I'm over on pulmonary now. Just looking for the best window I can find. Good angle. I want to see the valve. Go ahead and take a breath in for me and hold it. Okay, breathe out. Okay, very, very tiny breath in. Hold it right there. Don't breathe. So my valve is down right here. Grab that, stick a color on it. You should see a nice column of blue. Looking for the little candle flame jet. Sweeping through the valve. If I don't totally see it, that's okay. We look at this from different windows. Again, pulsed wave. Nice wave. Pick the best one you got. Excel time on the pulsed wave. Just jump right into continuous. We're still in a good window. Scale. Measure Vmax. Okay, so that is all those. What's the next level?
Mid.
So we're going to hit mitral valve first. Okay, look for the nice fish mouth. I should see again nice thickness of muscle all the way around. Should be consistent. If I'm like twisted off or something, I see something like that, I'm kind of halfway between views, or if I over-rotate, it's going to kind of come out the other way. And when it starts to look like a reversed peristernal long axis, you've twisted too far. So just twist back, make it nice and squared up. Everything should be pretty equal. Go and take a small breath in. Push it out as far as you can. So just holding a breath out. Again, I'm just trying to find that best window. Go ahead and breathe normal. So I'm going to go with that window there. I might be able to get that better, but right now that's good. Color box over it, so it should be over the entire valve. I need to see, in this case I don't need it very tall, I just need to see the entire mitral valve. We're looking again for leaks. So I'm sweeping through the valve, down into the ventricle, papillary muscle level, come back just a bit, There's my leaflet tips, my fish mouth. Go back into the left atria side just a bit, and I'm looking for any kind of leaks. So I just take a clip of that, but just to show you, if I go back and forth, I can see the fish lips open here. I'm scrolling backward, they close there. Now we don't have any leaks. I'm not seeing any mitral valve insufficiency there, but if I did, I'd see like a little spot of aliasing, blue aliasing in there somewhere. Okay, that's what we're looking for. Color off, papillary muscle level. So I'm going to scan down a little bit, just to find a different window. Take a small breath in for me. Hold it there. Again, the better the detail that we can see, the better. I'm going to open my box up just a bit, gain up just a little bit. Okay, good endocardial border definition. Papillary muscles are attached to the wall at this point. Then I go down to the apex. So I can either tilt down and see it, or I can slide down and go over top of it more. But I want to be out of the papillary muscle level. I want to see this right to just about where it comes to a small little donut. Okay, again, the key is to see the endocardial border definition. Okay, and that's all of our parasternals. Any questions about those? Anybody asleep yet? Hi.
What about?
So I usually drop the dropout out right away when I hit the apicals. Remember, you can use the dropout if you're having difficulty, especially with larger breasted women, or guys with really muscular chests, okay? If they're bunching their arms up, it's going to kind of compress all the tissue, and it's going to take your window out. So either move the elbow up so that that tissue can relax, and or drop out the dropout and the parasternals. Okay, so apical views again. Typically, you're going to come right where the chest tissue or the breast tissue comes and touches the chest wall. That's about where you should be. Give or take a little bit. So I went straight to there. You find where the heart is. Adjust my depth so I see a little bit beyond the atria. I want to see back behind it, because if there's fluid collections or masses or something, I need to see it. Okay, I'm going to get into kind of an apical 4-chamber view, and then I'm going to tweak it. So I want to see the wall definition pretty well. I'm going to move my focal position down about the valve level, about there. Okay. A little bit of pressure in now. Okay, I see the atria nice and open. Notice the bowing septum too, so you're looking for all the little tiny details. So I'm coming a little bit inferior, so now I'm down near the bottom of the heart. Take a small breath in for me and hold it. So she breathes in just a little bit, and I can get a better view. So I'm looking at the atria, that's a great view there. I'm going to tweak my TGCs a little bit. I'm going to take a clip of that just as an overall. I'm not looking right now at the walls of the ventricle, I'm actually looking kind of at the septum. So I kind of want to pay attention to that. Because I see that here right now, I'm just going to take a quick couple of shots, stick some color on it. If we've got a bowing septum, what's one of your concerns? Take a breath in for me.
An ASD. Or
ASD, yep, absolutely, or PFO. So some kind of a shunt or a leak going across that, right? So if we have redundant tissue, that could reopen things. So we just want to make sure we're not seeing any kind of leaks or anything like that. Okay. So my next image is, we want to get a good 4-chamber view. I'm going to do a Simpsons here now. So in the Simpsons, it's okay to cut off the atria by depth only, not cutting it off by sweeping out of it. I want to make sure we're still in the structure. But I'm going to take it about halfway into it so that my ventricle is going to take up the majority of it. Remember, ventricle has to be as long as we can possibly have it. I'm going to take a breath in for me. Okay, breathe out slowly. Looking for my best beat. Right there. Trying to see the best wall motion. Go ahead and breathe. Okay, I don't see the endocardial border definition the way I want to see it, so I'm just moving around a little bit. That's better. Okay, so you can take a clip of it, but I'm going to go back and do Simpsons. So see how I'm scrolling through a few times? I'm looking at the walls. I'm looking where they go. So there's a little bit of brightness here, so I'm going to take my gains down just a little bit. See if I can get rid of that. I want to see the walls actually goes up to here. So I need to see where that is. I also need to see, one of the hard walls to see is this lateral wall. So I'm watching the one that I have difficulty with. So there's my squeeze. Scrolling forward, backward. So I scroll backward till it's nice and dilated. I scroll forward a little bit till the valve shuts. That's my end diastole. It's ready to eject the blood. So I go into here, I find my volume measurement, which is at the bottom. And then I'm going to look for the biplane. So remember, Simpson's biplane is what it's called. So I'm looking for the 4-chamber view and diastolic velocity. Start at the annulus and trace your way around. Remember, you go a little bit faster is a little bit better. Don't go to this bright line here, because that bright line is actually becomes the epicardium. So you have to know where your borders are. So I'm coming up into here. I'm ignoring some of the trabeculations that are prominent. The papillary muscle I kind of ignore. Come around the outside, back down to the annulus. There's my length measurement. I agree with it. So I lock it in, and that's what it looks like. So that is diastole. Then I scroll to systole. Now again, see how I'm scrolling back and forth. Okay, so I'm going to go where I think it's the best squeeze, and track ball back here and trace that. Again, trying to know where these things are, the internal walls, is really important. Okay, again, I agree with the length. So that's the Simpsons. Okay. Got to take a small breath in again. I didn't actually grab a clip of that, so I'd like to have a clip of it as well. Take a small breath in. Hold it right there, don't breathe. Okay, just breathe normal. I'm going to scroll or zoom back out, or depth back out, so that I can see the entire structure. So now I'm going to focus on mitral valve for a second here. Let's take our MAPSI first, so cursor through the ventricle. Nice open chambers. Make sure that the atria are open when you do this. Rise and fall. Simple measurement. You just use a generic caliper because these systems don't have a setting. So this one doesn't allow me to go over to it, but I'm basically taking my line to where that goes to the lowest point. Take that. That's MAPSI. Narrowing my sector size. Remember, optimize your optimize everything you got. 2D to Doppler. Just trying to find a better angle for my mitral valve, which we're going to do now. Okay, so I look at the mitral valve. I want to take a nice clip of it. I'm looking at the 2D structure. I'm also looking at that septum. Stick color on it. I like to have a little bit longer color box, but make sure it's wide enough to cover the annulus. Again, looking for leaks in the mitral valve. If you don't see one, just take a representative image. Leaflet tips for the pulse wave. Baseline down. You can hear the beats a little bit different on each of those. Sometimes it's fast, slow. Mitral valve, so we're going to take the EA velocities. So again, I'm choosing this package, so when I drag it out, I mark what it tells me to mark. So I choose a nice waveform. I like this one, right where it's the real. Okay, mark the slope. And mark the A wave, which is here. That's all we should need for that. Okay, if we do like A duration, we can do that as well. So I'm going to choose A duration. I'm going to choose this wave here because I can see it better. There to there. Okay, that's going to compare to the A duration on the pulmonary vein. Okay, so that's mitral valve pulsed wave. So tissue Doppler. So it's a pulsed wave feature. So I'm in pulsed wave. Actually, this has a TVI button, so we're going to use the TVI button. In this case, it colorizes the map, so I'm going to go here onto the annulus. Do I expect to see it above or below baseline? Yeah, it's below. So remember, this is your S wave, your E and A wave. Okay? So when you have a nicely optimized system, it's easy to see. This, we simply measure the E prime if the system has it. So I'm going to grab my E prime measurement. And this gives us that calculation of E over E prime. Okay, so that's that wall. Then I need to do the other wall, so the lateral wall. So again, I can just kind of set that at the lateral side of the annulus of the mitral valve. Get pulsed wave to get back into it. This one typically has a little bit higher velocity than the other wall does. I'm just going to take this again as the E prime. It's going to average those two together. Get out of that. Pulmonary veins. So pulmonary veins, narrow sector. I need depth. I need to be able to see to the back of there. I want to see it in 2D if at all possible first. So I'm kind of scrolling through there. I'm maneuvering my window to see where I need to. Take my sector in good. And I'm looking for a red column of flow coming into there. So there's that nice red column of flow. It's near the posterior wall of the atrium. I'm going to go well inside it. I'm going to go a little bit blind here. Baseline down. Scale down. Okay, so as she breathes, it's kind of coming in and out. So, just to locate, so this is not my A wave here. Okay, the A wave has to come after the P wave on the EKG, which is going to be right in here. Okay, all I measure on this is the, since we did the duration of the A wave on the mitral valve, we're going to do it here on the pulmonary vein. So I want A duration. You might also do the velocity of the A wave. So A wave in this case is right there.
Hey Scott, you have like a little more than 5 minutes.
We can do this. Alright, tricuspid valve. So that's pulmonary, back to tricuspid. So we saw tricuspid already once. I'm moving more medial in this case, a little bit in between to get this view. See on the right ventricle now pops out a little bit better. Optimize your depth, all that stuff. This is how you work when you get in a rush. Stick color on. Open it the size you need. The key is knowing really where the buttons and stuff are. I'm sweeping again through the valve. Okay, this should theoretically be my best view for that regurgitation. So I'm looking at particularly the leaflet tips here. Again, baseline up, I mean I'm cranking them up. Scale, I know it has to go up. Okay, so I just want to show you something here. So my scale's not quite exactly where I want it, but I've frozen it. I could see a decent envelope. So I'm going to basically gain up here. See if I can see that a bit better. Okay, and I might try using like the color maps and stuff like that. May help pop it out a bit better. So just find one that, that works well. That one's kind of harsh, but it shows me what I need to see. So I'm going to leave it there for a second. I'm going to measure this. Remember, we were at 20 millimeters of mercury, so I'm kind of following my envelope here from what I see decently. So it's higher than that. My velocity is not quite good enough yet. So I'm increasing my scale some more. Searching blind here at the moment. Let's go live. it's all right around the same area. Not too concerned about that. So that is tricuspid. Now we want aorta, 5-chamber. So a little bit more lateral now. Again, I want a good Doppler angle. As she breathes out, I want to see the valve leaflets open. Color. Again, sweeping through, looking for leaks, which we don't have. As she breathes out, nice and open. Cursor, LVOT right in here. Pulse wave. LVOT, so we're going to do aortic valve, LVOT trace. Jump into continuous wave, we're in the still same good window. So remember I changed my maps, I'm going to change it back to something a little bit more normal. Scale. Get your nice waveform. Vmax this time is what we're taking, so I'm looking at the peak. Just take the best one you got. That's aortic valve. Got that. Forget anything? She good. 2-chamber, so 90 degrees to it. Take a small breath in for me. Okay, 2-chamber. Get that nicely lined up. Breathe away. Okay, coronary sinus at the back, see it come up nicely. Atrial appendage, color over it. There's a trace amount of MR here in this case that we didn't really see much earlier. Take a very tiny breath in. Right there, now breathe. Okay. I would also do a Simpsons here. Let's just do it real quick. I'm not zooming into it like I was before, but you get the idea. So volume, biplane, 2-chamber, annulus, trace, good endocardial definition. Squeeze in.
So we
2-chamber.
have 8:30 class and she has to get dressed. It's 8:29.
Alright. We're almost done.
It's your class.
It's more important than
That's right.
The other guy's teaching
Okay,
too.
so that is that. 3-chamber view.
Yeah.
So 3-chamber again, I'm looking for those valves to be open. Should be similar to your parasternal long axis. You take a small breath in. Right there. Again, sweeping through, looking for leaks. Okay. That's apicals.
Okay. Woo!
Alright, we'll do subcostals and that tomorrow.